Welcome to Energize and Revitalize with Dr. Amy. I'm Dr. Amy Coopersmith, a doctorate prepared nurse practitioner, and this show is about empowering you to live a radiant, healthy, and balanced life. I'm excited to introduce today's guest, Dr. Betsy Kreymer, physical therapist and owner of Excel Sports Medicine. Dr. Kreymer received her doctorate in physical therapy and bachelor's in athletic training from Nova Southeastern University. She founded Excel Sports Medicine on the principle of providing quality, evidence based care to help individuals achieve their goals. Dr. Betsy has extensive experience treating a variety of conditions such as general orthopedics, pre and post surgical issues, chronic pain, regenerative medicine, and sports performance. So, welcome. Thank you so much for coming today.
Thank you, Dr. Amy. Happy to be here.
Wonderful. So, Betsy and I met at CrossFit. You were doing a seminar on shoulder mobility, which happens to be one of my issues. I found it very helpful. And then over the years, as I tweak something and need a little help, you've really been great about getting me back into the gym, which I really appreciate.
Yes, I remember shoulder workshops are one of my favorite, and it's been great to be able to touch base and just keep you together and healthy over the years.
Well, thank you. And I think a lot of people struggle with different mobility issues, so it's important to address
Absolutely, absolutely. It also depends on what your sport and activity is, too, that every sport reflects, what you take away from one to strengthen the other. We all have limitations and issues, and that's where I come in.
Yes. So you were a college athlete.
I was.
Is that
You've done your homework.
I did. Is that what inspired you to get into physical therapy?
So actually, my inspiration goes back a little further than that. So long, long ago when I was a mere child, that I moved around a lot growing up, and I was living in England at the time. I was a competitive British gymnast. And at the time, they wanted England to be more competitive in the Olympics, and they brought over these Russian coaches. It was very serious, and gymnastics as a culture, especially overseas, was very strict. So as I was a little athlete, got injured, tale as old as time. But at that point, you don't say anything to the coaches. You just nod and keep going. So I continued to train on an injury for several years, and healthcare over there is very different than what we get in the States. So just kept training, and what's probably started out as a simple ankle sprain turned into ligament tears, bone bruise, and eventually the growth plate was affected, and I had my career-ending injury, and it wasn't until I came back to the States that I met this grown-up, and this amazing grown-up who was a physical therapist listened to all my issues and was able to help me. The first grown-up to ever give me any pain relief, and it was a physical therapist, and I was just in awe. And more importantly, as a kid, it's always the absolute. So my life is over, and I can't be a gymnast anymore, and what am I going to do? And she heard me out and gave me an option of sports that I can do safely in spite of my injury, and gave me this hope that for the future. And that was it. At 11 years old, I want to be just like her. I'm going to be a physical therapist just like her. So
That's so much pressure on a young body and a young mind.
Absolutely.
To have been through that. But that's amazing that you found someone who gave you hope and inspiration that really shaped the rest of your life.
Yep. So at 11, I wanted to be just like her, and every decision I made since then was to channel to become a physical therapist, from high school volunteer to internship hours, my undergrad as a trainer, just to get me to this point so I can be like her and help inspire others and get others out of pain.
Oh, that is fantastic. See, I didn't know that story, so I'm very happy you shared that with us.
Thank you.
So a lot of what I do in my clinic revolves around healthy aging. So what does that mean to you as a physical therapist?
I love this question. Healthy aging can just be, we can go down so many avenues of that from a PT perspective, definitely when we think of wellness for healthy aging as a whole, is to me how strong and resilient you can be, so that inevitably when accidents happen, if there's an injury, if there's an illness, that you've built this threshold to be so strong that when you're combated with that, you're not facing permanent injury. You're not in that extreme deficit where you end up being hospitalized or frail, and that permanent change that you're able to recover and bounce back pretty quickly because you've had that strength in your reserve. The other thing I would think of that I can relate with my patients for healthy and strong aging is just being confident in your independence, that you know that you have trained enough, that you have enough practice, strength, stability, endurance for movements that you're not going to hesitate to participate in the things that you want to do. And that could be as simple as your granddaughter is having a birthday party on the beach. You're not going to have that fear of, can I even walk on the beach? I'm fear of falling.
Right.
You know, I've done the work. I feel good. Absolutely. RSVP. I'm ready to go, and we're going to have a good time.
Yes. So important for quality of life to be able to do the things we want to do.
We love quality of life.
So people like me, I have friends and clients who do like to do things like CrossFit and running. Sometimes we're told, you're getting older and maybe you can't do those things anymore. So what do you think about that?
Hi, welcome to Dr. Betsy's segment of Pet Peeves. I feel like certain sports, especially CrossFit and the aging with the eye rolls, get such a bad rep. It's really not a death sentence to do things that you want to do, especially when it comes to exercise. It's just we run into trouble if we're doing something too much, too soon, too fast. If you've never done those movements before and you jump in and you start to ego lift, then sure, any age you're going to run into trouble. Barring any specific medical conditions where you're not allowed to do that specific impact, we can train for anything, and you're moving, you're staying healthy. I don't see anything wrong with that.
Yes. Do you feel like as people get older, they need to do things a little differently?
That's a great question. I think more warm up. I remember when I was younger, it was just walk in, put down my candy bar, touch my toes, cross the arm over my chest. All right, I'm good to go. And then now that I'm getting older, patients and age ranges, you get older, you feel that stiffness a little bit. Yeah. It's all about the warm up, and more specifically that purposeful warm up of being able to recreate the movements for your brain and your body on what you're about to do. So it's not just hugging your knee to chest and calling it a day. You need to practice those specific movement patterns that you're about to do so you can be ready for anything.
Yep. And I found even for myself as a runner, I used to take that first mile. That was my warm up. And I just go a little easy. Now I can't do that, or I can't do it very well. And it hurts. So I take that time now, and it's just doing things differently. I can still run. Just I need to be a little smarter about it.
Exactly. It's just, why are we doing the things that we do? That if, we just need to get rid of the bad thoughts. And so maybe that run is looking a little rough, but we got to do what we got to do. That's fine. But if we're preparing for something, we're doing something for a goal, we're hopefully eliminating or preventing future injury, we need to be conscious of how we're preparing for that.
Absolutely. So how does getting older impact our mobility and flexibility?
Unfortunately, it does.
Yeah.
A little bit. I think it's more of a domino effect, a little spiral, that as early as the age of 30, unfortunately, we start losing muscle mass, which is a scary, scary statistic. And then by 50, that kind of accelerates. So when we're starting to feel that weakness in our body changes, that maybe cascades into fear, where we're moving less, we're doing less, then we're going to domino effect into feeling that joint stiffness. We're not moving as much. It's going to limit our mobility. We don't move as much. We're afraid of injury. We don't move as much until we're stiff little candy canes. So
I was just reading something on my way in here. There was a stat that we lose 5 pounds of muscle for every decade. So
I need to put that on a birthday card.
I know. And then what we see also is weight gain as we get older. But that weight, if you think about the muscle loss and then the weight gain, so that's really unhealthy weight gain that we're experiencing if we don't do something.
Absolutely. And it's important to know and understand what your body's telling you rather than just going off the number on the scale.
Exactly. So what can people do to preserve that muscle as they're getting older?
Physical therapy.
I love it.
Not just physical therapy, really any movement, any strength training, just getting out there and move. The forces that you put on your body is going to signal things in your muscles, in your bones, in your tendons to strengthen and adapt to those demands. So as simple as going for a walk Tai Chi. I had a patient do hip hop, line dancing, whatever that is.
That
Whatever,
sounds fun.
right? I want to try it, but whatever brings you joy,
Yes.
get your body moving and your body will adapt.
Very good. Very good. So, what recovery strategies do you recommend?
My question would be, what are we recovering from?
So it's very activity specific.
It's specific. It depends on what you're feeling. If you're recovering from an injury, then that
Right.
recovery plan is going to look differently than, hey, I'm training for a competition and I'm just sore a little bit leading up to that competition day, and that's going to be looking like recovery so I can get the most out of my training days, compared to I just walked around Disney World and that was 16 miles and I'm a little sore. What does that recovery look like?
Right. So a lot of times if we do experience an injury, let's say we go to a traditional practitioner, we're told to stop what we're doing and to rest, which there is a role of rest, but what happens when we don't move an injured part?
Welcome back to part 2 of Pet Peeves with Dr. Betsy. The absolutes of completely resting and not identifying what our body is trying to tell us is not addressing the root cause of why you're having pain. So yes, you feel better with absolute rest, but then after that few days, few weeks of doing nothing, you start up that activity again without addressing why that happened. And then you're going to go right into that cycle of it flaring up. So with the rest, maybe letting those specific tissues recover, but working with a physical therapist, at least for me, that will make a treatment plan where we can continue to strengthen, to move, to get blood flow to that area in the presence of pain. So those specific structures recover, but we're still creating those movement patterns. We're not losing muscle mass. We're not losing confidence.
Mm-hmm.
Certain structures actually like load, even if they're inflamed. So it's really identifying what our body's trying to tell us, what the injury is, and then we go from there and you can recover faster.
Yep. And, my most recent injury, you really helped me out. I had hurt my knee, which wasn't a typical injury for me, and I didn't know what to do with it. And you kind of got me right back in shape and back running, and I was very thankful for that.
Yes, and that was fun, and I appreciate the curveballs that you throw at me.
My body doesn't always act the way you think it should.
Bodies never do. But, we have a plan for one body part. You come in with another. We
Right.
pivot. We've figured it out. We're
Keeps
healed.
things
It's great.
interesting. Yeah. So strength training is important for injury prevention. You also mentioned bone strength. And that's something that, especially for women, as we get older, we lose our bone density. So have you found that, having a good regimen can help prevent that?
Absolutely. Absolutely. It also depends on your bone density going into strength training.
Mm-hmm.
If you're on the borderline of osteopenia, that's going to look different than if you have osteoporosis.
Mm-hmm.
It's going to look different than if you have good bone density and you want to maintain that. Any gravity, land-based weight training is going to help tell your bones and
Mm-hmm.
stimulate that bone growth of, hey, I've been adapting to this load. Can you make more bone to help strengthen that? If we're borderline, that's where we can incorporate water workouts, maybe offloaded gym machines where we don't have as much load or torque on those bones and muscles until our body acclimates to that. So there's always something that we can do to continue to strengthen and have that very strong frame.
Yes. Okay, I'm going to have you hold that thought. We're going to pause for a break from our sponsors. You're listening to Energize and Revitalize with Dr. Amy. Don't go anywhere. We'll be right back. Welcome back to Energize and Revitalize with Dr. Amy. I'm Dr. Amy Coopersmith, and my guest today is Dr. Betsy Kreymer, owner of Excel Sports Medicine. Before the break, we were talking about age-related bone loss and how strength training can help reverse that. So, Betsy, can you elaborate on some safe exercises people can start if they've been diagnosed with osteopenia or osteoporosis?
Absolutely. It first depends, getting cleared by your primary care physician. I would want to see personally the testing, the results on what level of osteopenia and osteoporosis you're at in order to recommend safe
Right.
impact exercises. It's always safe to start in the water. It's going to eliminate some of gravity, body weight for that excessive load. We can adjust that over time in the water as well. We call aquatherapy or pool workouts. Always so fun. I saw once of spinning in the water, which seemed
Oh.
so difficult. So really, you can adjust how extreme you want to work out in the water from there, and then adjust the buoyancy from chest height to waist height, and slowly acclimate into land workouts where you start putting impact into those bones and seeing results.
Yes, I've been reading a lot, about healthy aging. Imagine that, and I was surprised at that. Sometimes they recommend jumping exercises for people with osteoporosis. Not right away though, but that impact is so necessary for that bone remodeling and recovery.
Absolutely. It goes back to, there's a dark corner in my mind from school. It's called Wolf's Law.
Oh,
So it's your body's response to that load. So it may not start right away from jumping, maybe jumping in the pool.
right.
And then you start walking and getting that load through your bones, and that force that you feel through your bones is sending the signal to start building bone cells and start increasing your bone density. With that, fast walk turns into running or jumping. You get that slow impact, and that's how that happens. Thanks, Wolf's Law.
So important. And I know we've mentioned before in previous episodes, a fracture can just be devastating to a person and can even, put them in a nursing home. So preventing that fracture with healthy strength training is just important for our overall well-being and longevity.
Extremely, extremely important.
So one thing we encounter in our practice at Amethyst, we do quite a bit of weight management for people. So a lot of people, when they're struggling with obesity, having excess weight on their bones and joints, they have pain. So one thing I tell them as part of when they lose weight, I want to make sure that they're losing fat pounds and not muscle pounds. So I need them to move, but they hurt when they move. So what are some strategies for someone in that situation?
That's an excellent question. I mean, it's a similar approach that I would take as a physical therapist if someone has an injury or has a bone density issue. Just through physical therapy, we do a full body assessment and identify any issues or limitations to the movement. If it is the obesity where is causing the pain specifically, there's no underlying injuries or issues. It's how your body is absorbing the force in order to do the thing. So if we don't have the muscle mass or the joint stability to absorb the force, then that pounding is going into the joints and the bones themselves, and you're feeling pain. So it's learning on how to move your body to distribute that force more efficiently and more safely. And then in turn, those patients will gain confidence on moving, and that you know that you can move without pain. And then we further progress to increase that intensity, where we start seeing the numbers change on the scale and feeling stronger, feeling better.
Very satisfying.
Absolutely.
Yes. Okay, so we mentioned someone coming to you, they get an injury, they come, they say, I need physical therapy, you help them through that injury. Do you work with people with chronic pain for the same thing?
All the time.
Yes.
All the time. My specialty is in sports medicine and orthopedics, and even though I do see a population of high school, collegiate, professional athletes and active adults where they have that fill-in-the-blank story of I was tackled in a football game, I rolled my ankle on the soccer field. In those injuries, the majority of injuries that I see are chronic or overuse injuries. So it is really rewarding being able to work with those patients because they start day one of I've had this pain for 5+ years, 10+ years, my whole life. I don't know what you're going to do for me, but it's the same approach of identifying where they're moving, how they're absorbing force, and then changing those body mechanics to make it more efficient and give them that relief.
So with the rise and popularity of pickleball, are you seeing pickleball injuries?
I am. Man, pickleball in Palm Coast especially.
Crazy.
It's crazy. I haven't given in and drank the Kool-Aid to actually try it yet. I don't have that hand-eye coordination, and I found it doesn't involve pickles, so what's the point for me? But it's definitely changed the injuries that I see. It's always related to the sports in the area that I'm seeing those patterns and where I live. Pickleball injuries have been reflecting similar to tennis injuries and a little bit of pickup basketball of that stop-start, that
Right.
pivot, change of direction, tendon strength, balance. So I've heard it's very aggressive, very competitive. So
Those people are serious.
they're no nonsense.
I have tried it. I am not good at it, but it's fun to kind of dink the ball back and forth. I break the rules all the time.
And I will come and cheer you on and support you from the sidelines.
But you're right. There is a lot of quick movement, and even for somebody who works out regularly, these are movements that are different. And again, I have to take your advice of warming up.
Very different. Very different. Remembering that every sport is different and not to do too much too soon, too fast. And even if you're strong in one sport, it could be a completely different movement pattern in another.
Absolutely. Do you feel that physical therapy can reduce our risk of being on chronic medications or even having to have surgery?
Absolutely. There are a lot of research and studies with that, of the mantra of physical therapy first, adopted by the APTA, that if it's more cost efficient in the long run, it's healthier in the long run, it reduces the need for unnecessary surgeries of getting physical therapy first, because it's learning about movement. It's using our body's natural resources of strength training, being confident in our movement, of balance, of endorphins, getting natural blood flow, and manual treatment for pain relief, rather than having to cut and then you're affecting those tissues permanently and looking for a short-term pain relief of maybe with pain medication, which in conjunction with physical therapy could be a good option temporarily, but we don't want that to be a permanent solution. I want to find a long-term solution of identifying the why and then fixing that.
Yeah, and even if somebody does have to have surgery, then they can see you very quickly after to recover quicker.
Absolutely. And speaking from personal experience myself, had a couple of surgeries under my belt, that recovery will help you in the long run, so you don't have that permanent change in learning how to move your new body after surgery.
So you have some other tools in your arsenal of treatments where it's not all about movement, but you have things like needles and things like that.
Don't scare the listeners.
They're little needles.
Absolutely. With physical therapy, everything we do serves a purpose. And once we identify deficits from that evaluation, I like to treat those issues either with exercise, with manual treatment, or with both. And manual treatment can look differently for a lot of people depending on what someone's comfortable with. Obviously, I am not going to needle someone that does not like needles, or if we have bigger muscle groups, if you're an adolescent, if you're an older adult on blood thinners, things like that, there's a range. So in my bag of tricks, we have a bunch of different options, including just good old hands-on massage therapy. I'm not a massage therapist, but the feel good, just to release those trigger points and create an opportunity for movement, so that when we go out on the floor and do exercises, your body is ready to go and not bracing for pain. The needles are dry needling, which is a technique by physical therapists that help desensitize the nerve and go directly to that trigger point, which can be extremely satisfying, and that instant relief, which I really love. We love cupping from Michael Phelps in the Olympics, of those little octopus pepperoni marks that can give some trigger point relief and blood flow to specific muscle groups as well. That I like doing some active range of motion at the same time. So we're learning how to move our bodies without pain and kind of retraining our brain for that, so we feel more confident. And then we have some good old-fashioned scraping, which is like an industrial massage roller.
You could call it that.
That also looks like a crowbar and can scare small children, but it feels good after. So
it sure does.
We love all of it.
Yeah. It always amazes me that sticking a needle into a spot that hurts makes it feel better.
Who knew?
Right?
I'd love to be the first person that was the guinea pig of just hear me out. Let me just stab you real fast. But I think it brings pain relief, and especially with patients that have had chronic pain or in severe amount of pain, or this is the worst pain they've ever experienced in their life, you'll do just about anything to get some relief. And I'm glad to provide that for people.
All kinds of things. So do you ever recommend certain supplements or different diet types to help support what you're doing?
For physical therapy, we in school do get nutrition classes, but supplements aren't really my expertise. I firmly believe in a team-based approach where I will happily connect patients with a nutritionist or a dietitian, where That's their expertise. That's all they do. And we can all work together to get you back as quickly as possible and give you that relief. From my end, my nutrition recommendations are always purposeful for your recovery from injury or from pain. If you're trying to rebuild that muscle from injury or surgery, high protein, in addition, protein to that dinner plate is always good. And any anti-inflammatory foods are excellent for preventative and treatment of injuries, just to reduce any pain, any joint pain, that recovery, even just from a hard day of working out.
Yeah, and those foods help prevent different diseases as well. So we all like
It's
those.
all great. And some of them are pretty, pineapple, blueberries,
Yes.
tart cherry juice, fish oil, all delicious.
Mm-hmm. So do you have that one inspirational story, that aha story that you like to tell?
I feel like I have so many stories in my arsenal now. It is so hard to choose one. Unlike other healthcare professionals, as a physical therapist, I have the luxury of seeing patients 1 to 2 times a week for weeks or months at a time. And you really build those relationships with people and learn about their goals, their activities, and just to be part of their journey and see them from day one or all the way through and reach their goals is just so inspiring. And even from teaching people how to walk again, so a patient can walk their daughter down the aisle for their wedding day, recover from shoulder surgery so that they can compete in that CrossFit competition, is just a full range that I've seen. But if you're asking for my personal favorite inspirational story, I would have to say my own.
Yes.
So back in 2022, I ruptured both of my Achilles at the same time. Because I am so talented and competitive, and if I'm going to injure myself, I need to give
You're good at it,
110%. Yeah. Yep. So I picked an injury where it is a less than 1% chance of happening. And going through that injury, several surgeries and complications, it was years of recovery. And compared to the injury that inspired me to be a physical therapist, and inevitably that surgery when I was younger, compared to going through an injury and surgery as an adult, was a completely different experience. And the financial strain, the mental depression, the fear of the future as an adult was extremely humbling. And so I've used that experience now directly with how I treat patients of
What it feels like.
absolutely, absolutely. And understanding that this pain is just a chapter of your life. It's not the definition. The diagnosis does not define you. And if you put in the work, you will recover. It may take a few years, but you will recover.
You will recover.
Yes.
Well, I really want to thank you for joining me today. How can people get in touch with you to learn more about you?
Absolutely. So you can follow me on Facebook or Instagram at social media at Excel Sports Med, or check out my website, excelsportsmed.com.
Wonderful. Well, thank you again.
Thank you so much, Dr. Amy. It was so fun.
Yes. And thanks to our listeners for tuning in to Energize and Revitalize with Dr. Amy. I'll be back next Saturday morning at 7:30 with more expert insights and practical strategies to help you live your best and healthiest energized life. Until then, stay healthy, and here's to your best life.